Disc bulge causing spinal stenosis. Here's what really works without surgery. This is a disc bulge, and this is spinal stenosis. If you have leg pain, numbness, or burning, but barely any back pain, this is probably why. Most people treat the pain, but they miss the real cause, and that's why they stay stuck. In this video, I'm going to show you the surprising reason a disc bulge causes spinal stenosis and the non-surgical treatment that's helping people walk again without surgery. Stay with me. I'm Dr. Gregory Kramer. I have over 35 years of clinical experience and advanced certification in chiropractic biophysics. I specialize in treating people with chronic health problems, chronic neck pain from whiplash, chronic L4, L5 disc problems, chronic peripheral neuropathy, chronic knee problems, chronic foot problems. And today we're going to talk about how a disc bulge can cause chronic pain going down your legs. I use a variety of corrective methods, spinal decompression, and targeted exercises to reshape the spine as close to normal. Now, before I continue this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, stabilize your spine, avoid spinal surgery so you can live stronger longer. What is actually happening in your spine when there's a disc bulge and spinal stenosis? Now, this is a tough look. This is your disc. This is the front of your spine. This is vertebrae. This is the top of the neural foramen. This is where the nerve that comes from the spinal cord goes to the different parts of your body. So this is the back part. This is the front. Think of this hole, this neural foramen, as a canal. And there needs to be lots of room for this nerve. Now I'm going to show you what a bulge or a herniation would look like. Now watch. Look at the red mark. That's a tear or a crack. Now watch this seeping. That is a herniation or bulge. Now that will press against this nerve. Very painful. That could cause butt pain, leg pain, and affect your ability to walk. Now obviously, now watch, I'm going to do it a few times. This is a bulge or herniation. We want to use decompression to suck that herniation in. This is a bulge or herniation right there. This is the nerve that carries energy. All right, now we're talking about this space from the front to the back. Let me break it down simply. When the disc bulges or herniates, it's not just an injured disc. It's physical pressure building up inside the spine. That pressure pushes into the neural canal, narrowing the space for the nerves. That narrowing is called spinal stenosis. Stenosis is an occlusion of a hole. Now, it can be caused from a disc bulge pressing right in that nerve channel. But here's the crazy part. You don't need back pain for this to be severe. Most of the time, people feel in their legs. They might feel numbness, tingling, burning. They might have weakness while they walk. Or worst of all, they can lose their balance or even have foot drop in severe cases. And if that pressure isn't relieved, it can lead to permanent nerve damage or disability. But here's what no one is telling you. That disc bulge doesn't just happen randomly. Something has to cause it to fail. So when those vertebrae misalign, well, the disc is attached to the vertebrae. So if the vertebrae goes back, guess what? The disc comes back. And that undetected or subtle pressure puts extra stress on the disc. Think of it like a crooked foundation of a house. You can patch the walls, but if the structure's off, the cracks keep coming back. And the longer the misalignment stays, the more your disc bulges, the more your nerve gets compressed, and the narrower the spinal canal becomes. Now, what happens when you have the wrong treatment? The wrong treatment makes it worse. Now, this is where most people go wrong. They stretch, they foam roll, they do all these random disc exercises from the internet. But the spinal pressure doesn't go away. In fact, some movements make it worse. Painkillers, of course, they help a little bit, but they mask the pain and the pressure still crushes your nerve. Cortisone shots, temporary relief, but it doesn't affect the root cause structurally. If you don't fix the cause, that disc keeps pressing, that nerve keeps dying. Now, this is where non-surgical spinal decompression comes in. What we use is a precise computer-guided table that gently stretches and pumps and decompresses your spine. It targets the exact level of the disc, L4, L5, L5S1, wherever the problem is, and it helps pull pressure off the nerve, giving it space to breathe and heal. Study shows it can reduce disc pressure, promote disc rehydration, and relieve nerve compression without surgery. But that's just phase one. So think of decompression as a pump. It pumps fluids in and out of the disc. We want the inflammatory material to leave. We want healthy nutrients and blood to go in. Now, the second phase of care, it really is to fix the structure, the underlying foundation, so we stop the vicious cycle. And that's where I come in. That's where people who use chiropractic biophysics or CBP come in. CBP, that's short for chiropractic biophysics, is the only chiropractic method that's been shown in studies to improve alignment over time without surgery. So there's 3 steps to the CBP procedure. The first is we call mirror image exercise. Exercise to retrain your alignment or posture towards normal. Step 2 is a mirror image adjustment. That's where we're correcting your alignment towards normal. And the third and most important to change alignment is mirror image spinal traction to remodel the spinal curves and improve alignment. Now remember, think of decompression for pain relief. It's a pumping mechanism to improve the health of the disc. We want to get blood in, we want to rehydrate the disc, we want to create a healthy environment to that disc, we want to reduce that disc distortion. Step 2 is correction of the alignment. When you have misaligned spine, you're putting abnormal pressure on the disc, and that's what CBP is all about. So together, these help restore normal structure, take pressure off the disc, and prevent future flare-ups or injuries. So the bottom line is when you decompress the disc and realign the spine, you get a double benefit. First goal is pain relief. I want people out of pain as fast as possible, and all the doctors I know want the same. The second phase, this is different. We want long-term stability. So we want you not only functioning good now, we want you at a high-level function later down the life. And the results can be life-changing, like walking without pain, sleeping through the night, avoiding surgery, walking to your kids' and grandkids' baseball games, and getting your life back. It's not just about temporary relief. We're talking about reversing the cause before it becomes irreversible. This is an example of what happens under non-surgical spinal decompression. This is the patient lying face down. This is a disc. These are nerves carrying energy. And you will notice that when this structure, this disc right there, bulges and herniates, it's pressing on this green structure or the nerve. That is what happens with a disc bulge or herniation. This is a classic x-ray of somebody standing facing straight ahead like this. You will notice that the yellow line is off from the blue line. The blue line is normal and the yellow is abnormal. This person's rib cage is shifted to the right relative to the pelvis. That's going to put unequal pressure on those last 3 discs. Now over time, just like if you have unequal pressure on a car tire, that tire wears out. Same thing with the human spine. Unequal pressure on the disc will cause the disc to break down. That could be bulge, herniate, or degenerate. So spinal decompression is the first step for disc healing, but correcting this alignment is the next step for long-term relief. So this is an example of someone doing CBP, chiropractic biophysics, to reshape the spine for a disc bulge, disc herniation, L4, L5. You will notice the person's rib cage, we are shifting it to the left. So their posture and their x-ray, their rib cage was shifted to the right. We are shifting the spine, and when you shift the spine towards neutral, towards correction, that takes pressure off the disc. Now this cannot be done right away in an acute problem. So the first step is to get a person out of pain, and that's what spinal decompression is. Once you are comfortable, once you can lie on your side, then we start correcting your alignment. So we need to get you out of pain long before we start making a spinal correction. But this is necessary for long-term management of a disc. So we're not just interested in temporary relief. We want long-term management. Step 1 again, spinal decompression. Step 2 is chiropractic biophysics. Mirror image, exercise, adjustments, and traction. This would be a mirror image corrective traction For a rib cage that's shifted right, we are shifting it left relative to the pelvis. Back surgery may not be your only option. In fact, for 95% of you, you can avoid serious drugs and surgery. Now, sometimes surgery is necessary, but we're talking a very small percentage. There are non-surgical options that are working when done right now and done in the right sequence. A combination of non-surgical spinal decompression with corrective chiropractic biophysics may be the exact combination that you've been missing. If you found value in this video and learned something new, do me a favor, like and share it. Leave a comment. What treatments have you tried for your disc bulge or herniation or stenosis? What actually helped? What made you worse? Let us know. If you want to see exactly how spinal decompression works, watch this video. Non-surgical decompression for L4, L5, disc problems, permanent relief. You will see why spinal decompression could be your key to finally overcoming an L4, L5 disc bulge pain for good.